Hello everyone, let's learn about portal hypertension today. All the visceral GIT organs are supplied from the heart by certain arteries, but blood from these organs will not go back to the heart directly, but instead it will first flow through the liver and then it will go to the heart. This venous connection between the visceral GIT organ and the liver is called hepatic portal system. In hepatic portal system, veins from the stomach, pancreas, spleen, small intestine and large intestine, these will form a vein called hepatic portal vein that will supply the liver. Then the blood will be drained into the inferior vena cava. Now if there is any resistance to the blood flow through this system, that will create hypertension here, and that is called portal hypertension. There can be prehepatic causes, intrahepatic and posthepatic causes to this hypertension. There can be a thrombosis in any of these veins or the hepatic portal vein that can cause portal hypertension. There can be some serious liver infection like cirrhosis or hepatitis that can damage the veins and that can cause portal hypertension. Or there can be problem in drainage here like inferior vena cava obstruction or Budd-Chiari syndrome or right heart failure that can also cause portal hypertension. As the blood pressure is high in these veins, then the fluids will leak out and that will cause edema and ascites. Now there are certain systemic veins in these organs that has already anastomosed with the portal venules. Now if the blood pressure is high in these veins, the blood will forcefully move to these vessels and they will balloonate these vessels and hemorrhoids are formed, and those are called anorectal hemorrhoids. So the patient will be presented with anorectal hemorrhoids or anorectal varices. Similarly, the patient will be also presented with esophageal varices and the patient will pass blood through the stools and will have hematemesis. Lastly, there is a vein called umbilical vein in the fetus stage that has changed into round ligament in the adults. Now if the blood pressure is so much high here, then the blood will recanalize this round ligament and blood will move through this ligament. And this blood with high pressure will form varices in the superficial veins of the belly. This condition is called caput medusa. The most common procedure for the treatment is TIPS, transjugular intrahepatic portosystemic shunt. We insert a catheter through the jugular vein, we move it through the inferior vena cava into the hepatic veins, and we move into the portal system and we place a shunt in the area where there is the obstruction.